Good afternoon, sir.
Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institutes, and today we are executing this simple role play, which is of course very simple, but again, sometimes we do various kind of mistakes. So to avoid those mistakes, I'm doing that again. Emergency department, local hospital. So again, I have always told you when you are in the emergency department, so obviously patient is coming on emergency. Then let's see what is the emergency. This 35-year-old patient was involved in a car accident earlier today and is now suffering from a headache and whiplash injury. He is being kept in the hospital for observation. What is expected to be discharged later in the day. That means he is better. Now suffering from headache and a cervical spine injury. He is kept in the hospital for observation. So again, you can simply start. Hi, my name is Dr. BKM, or my name is Bhupesh. Sorry, in this case, we are nurse. So my name is Bhupesh. I'm a nurse here. I'm a nurse here. और आपको हमेशा सिखाया और ये चीज आपको लिखनी है पेपर में. You have to write this sentence in the paper क्योंकि आप देख के बोल सकते हो. And I have read your case notes. Just simply, I'm a nurse here and I can see from your case notes. This is easy. I can see from your case notes. बिल्कुल simple. That you were in बिल्कुल same. That you were involved in a car accident earlier today and you are having headache at the moment. Am I right? Also, doctor has told that you are having an injury to the cervical spine, which is known as whiplash injury. So I would like to ask you, do you know why are you being kept in the hospital? Simple. Again, go with the flow. So I would like to ask you, do you know the reason why are you being kept in the hospital? No, nurse, I do not have idea. So say, don't worry, you are being kept in the hospital just for the observation, because at this point of time, you look all good and there is nothing to worry. It's just you are suffering from a headache and also you have injury to the cervical spine. So you are under the observation, but otherwise you are completely out of danger, but we need to observe you for some time. Also, I would like to advise you the reason of taking and continuing the medications. Medication will play a very important role in managing your pain once you return home. You can also relieve your pain with heat and ice application, and also analgesics as prescribed by the doctor are very important. Apart from this, a collar will be provided to you which will be very important. Again, आप ये बातें पहले लिख सकते हो. आप क्या यूज करोगे? A collar will be provided. पहले लिख दो. टेंस की गलती कम करनी है, इसीलिए हमें पहले लिख देनी चाहिए. Also, I would ये वाला point again OET की सबसे important बात. ये वाला point, what is the best care practices after the patient leaves the hospital? तो रहने दो. अगर आपको नहीं पता लग रहा तो leave it. There is no reduction of marks. Please मत लिखो. Don't speak about it. Describe the benefits of consulting a physiotherapist. Also, I would like to advise you that you should consult a physiotherapist who will tell you about the exercise and the relation exercise and the relaxation exercise to loosen up your joints, as it is very important. So bilkul simple. Again, I'm telling you, make it very simple. Write on your sheet, make it the easiest you can. Also, I'm afraid to say that we cannot say about the complete recovery as it is an internal injury. So it is very hard to say how much time it will take. But one thing is important to be noted, that if you will follow the doctor's instruction, your recovery will be fast. It might take 1 to 3 weeks. आप अपनी तरफ से बोल सकते हो. अगर नहीं दिया तो stress the importance of complying. It is very important to comply with the treatment, that is to take analgesics on proper time and also to use heat and ice application. And apart from that, exercise programs are very important. And last but the most important thing is to seek medical advice if there is any increased pain or discomfort or nausea and vomiting. So always talk like this, make it very simple for yourself. So आपके लिए टास्क बहुत इजी हो जाएगा, बट स्टिल आई वुड डू इट फॉर यू, ताकि आपको एक बार बोल के पता लग जाएगा कैसे है. सो इन एग्जाम हाउ वुड यू स्पीक ऑफ इट? लेट मी टेल यू. हाई नहीं बोलना, सॉरी, यू शुड से गुड मॉर्निंग एंड गुड आफ्टरनून. इट्स अ फॉर्मल टास्क, सो नेवर यूज हाई. सो ओके. Good morning, my name is Bhupesh and I'm a nurse here. I can see from your case notes that you were involved in a car accident and now you are suffering from headache. Am I right? Yes, nurse, you are right. Also, I can see from your case notes that you are having whiplash injury, that is injury to the cervical spine. Do you know the reason? Why are you being kept in the hospital? No, nurse, that is why I'm so concerned. That doctor says I am fine, but he's keeping me in the hospital, so I'm really worried. See, please don't get worried. Whenever we have incidents or car accidents like these, and also you are having headache at the moment, so it is very important to observe you. So you are being kept in the hospital for observation, and you will be glad to know that you are expected to be discharged later in the day. Okay, nurse, do you think I would be discharged? Of course, you will be discharged. It's just about the moment that we need to observe you. That is why you are being kept in the hospital. Also, I would like to advise you that it is very important for you to take and continue the medications even after discharge. Doctor has already prescribed you certain painkillers, which are very important to manage the pain even after you return home. So once you return home, it is very important to take those medications as prescribed by the doctor. These medications are painkillers. Basically, they are known as analgesics and help you to relieve the pain. Apart from this, I would like to tell you some other methods like heat and ice application. So when you reach home, you can use the heat and ice application alternatively. That means you can apply the hot pack for some time around your neck and around your spine, then take some rest. After 1 hour, you can put the ice application. So what heat does, heat helps in the blood circulation and provides you good circulation for recovery, whereas ice kinds of help in subsiding the inflammation. So ice act as anti-inflammatory. So it is very important to use the both things, but after the interval of 1 hour. Also, doctor has prescribed you a collar, which will play a very important role to stabilize your neck. So please understand and wear the collars whenever required. Further, I would also like to tell you some more benefits. So before telling you more benefits, I would like to ask you, have you understood everything? Yes, nurse, I have understood everything. Well, that's nice to know that you have understood that we are keeping you in the hospital for observation. Medications are very important. And for the pain relieving, heat and ice packs along with collars should be used. Apart from this, now I would like to tell you that even exercises will play a very important role in your recovery. So now you should consult a physiotherapist who would teach you about the exercise and other relaxation exercises to loosen up the joints, as when you have car accidents and injuries like whiplash, it is very important to loosen your joints. So for this, for the relaxation of joints, physiotherapists are the best doctors to be consulted. So should I fix your appointment with the physiotherapist? Yes, nurse, that would be really nice. Okay, so I will fix your appointment with the physiotherapist. And now I would like to tell you that it is very important to comply with the treatment and exercise program told by the physiotherapist and the doctor. Please comply with all the program because it will help in your swift recovery. So it will help in your speedy recovery. So please understand these are very important. So do you have any other question? Well, yes, nurse, how long would it take? See, at this moment, it cannot be said that to recover fully, whether it will take 2 weeks or 4 weeks, because you are having a whiplash injury, which is kind of an injury to the spine. So in cases like yourself, we cannot define whether it would be after 2 months or 4 months. So you have to be little patient, but doctor will be there to advise you. And also there is a review after a week. So maybe after a week, we would be able to tell you in a better way that how much time would it take. So after a week, we are fixing your review appointment. Is it okay? Well, yes, nurse, that would be nice. Okay, that's glad to know that you have understood everything. And now I'm giving you this leaflet. It contains all the instruction, whatever we have discussed. And also please follow these instructions and follow the protocol as described by the doctor and the physiotherapist. And I assure you that you will recover faster. Okay, nurse, that sounds all right. But nurse, like just one last question. Like, do you think I can suffer from any complication? Yes, there can be some complications, like if you feel any increased pain, discomfort, nausea, or vomiting, and especially the vision problems, then please seek medical advice immediately. The leaflet that I have provided you also contains our number. So please dial that number in any cases when you have increased pain, discomfort, nausea, vomiting, or vision problems, so that we can help you. All right, nurse. Okay. So have you understood everything? Okay. So now I am leaving. So you take some rest over here. Doctor will come soon and will attend you. Also, there is a buzzer beside your bed, which you can press if you need anything. Further, this is the leaflet. Please read these instructions. If you have any doubt, even then you can press the buzzer. And I reassure you, if you follow doctor's instruction, you will be fine. This is how you execute the role play. You can write anything on the role play for 3 minutes. Write anything on the role play for 3 minutes and then speak for 5 minutes. So please understand, it's very easy. Just try your level best and you would be all good to go. And please listen to this recording 3 times, 4 times, 5 times to learn the best. And always use this data. This data is for your help. Please use this data. If there is any data that disturbs you and that you are not happy about, please do not talk about it. There is no deduction of marks in OET if you do not speak any point. So if you don't like it, just skip it. Speak rest of the points and you will get the marks. You will get the complete marks. This is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967342256. And you can contact us anytime for the best OET coaching. This is Dr. Bhupesh from Dr. BKM Institutes. Thank you.